Hello, I am Dr. Sagar Jawale. I am a stem cell therapy expert and I am practicing stem cell therapy from last 7 years in my Jawale Stem Cell Therapy Center in Jalgaon, Maharashtra. Uh, I have taken degrees from Government Medical College from Mumbai's KM Hospital and Sion Hospital. In last 23 years I have been practicing in Jalgaon, out of which 7 years I have been doing stem cell therapy for various diseases. This particular video we will discuss stem cell therapy for erectile dysfunction or impotence. Please subscribe to this channel by pressing the bell icon button below and like this channel so that whatever new videos I make you will get them immediately. In short, we will see what is erectile dysfunction. It's a disease of the male people, young adults particularly, when their penis has erection but that does not survive long, or there is premature ejaculation and the penis loses its strength before the act of sex is complete. That is known as erectile dysfunction. That leads to a lot of marital problems. It can be a ground for divorce. It is fairly common, and as much as 10 to 20% of the males sometimes in their life can experience erectile dysfunction. The commonest causes are blood pressure, diabetes, and something more common is idiopathic, where cause is not known, so they call it idiopathic or psychological. So what we do in this, you have to stay in the hospital for 3 days in Jalgaon, Maharashtra. One person must accompany you. First day we call you, we do your investigations, do your penile Doppler and do your fitness. The next day morning we give you spinal anesthesia, a needle in the back, and the lower side of the body gets anesthetized. Then from your backbone, from the iliac crest, some 100 ml of bone marrow is taken out. Then immediately it is processed and stem cells are relieved from that in the stem cell laboratory which we have in place in this particular hospital. Then these stem cells are injected into the penis. So at the base of the penis, first a tourniquet is put so that the cell should not get washed away immediately. Then in either side we give equal quantity of stem cells. So if there are 10 syringes, 5 on one side, 5 on other side, we keep tourniquet for 10 minutes and then release the tourniquet so that the cells are now implanted and engulfed inside the penis. If some quantity of stem cell is extra, that is given intravenously into the vein, peripheral vein, so that it goes to the rest of the body. Then for 2 days we put you for observation, and if nothing is wrong, then on the 3rd or 4th day you can go home. So that is what the procedure is. Now we will discuss how the stem cell therapy works. This is quite a new therapy, and there are very few centers in India and in the world, and ours is one of those centers where such a therapy is offered. Often platelet rich plasma PRP shots are given to the penis, and that also gives some results. Stem cell therapy may be easily many times more powerful than the P shots. And how it works, because the stem cells when implanted into the penis, they multiply, they double every 3 days and survive up to 3 months to 6 months. In that time they make a huge mass of cells, and the corpus cavernosa of the penis will be regenerated in that process. And the main problem in this patient is they have a venous leak, so that can be regenerated with this particular therapy. Some patients have the fibrosis of the corpora, so that is also regenerated to some extent. And the cells also produce 50 types of growth factors and cytokines, which repair and rejuvenate the cells in the tissue, in the penis. So that is the mechanism of how stem cell therapy works. Results come in 3 months' time and not immediately. And results keep coming up to 1 year, sometimes up to 2 years. After 1 year, the therapy can be repeated, but may not be necessary in many patients. And therapy can be repeated any number of times. That is the beauty of this particular therapy, because bone marrow is replenished within 1 month usually. So whatever has come back, you can take it again and put it into the penis or other part of the body. The side effects noted were very negligible and not non-critical, such as you may have some pain or hematoma at the site of bone marrow injection or at the site of stem cells injection. Then there may be some fever or some skin rash. That's all. No serious side effects were ever noted. And what are the results? Then most of the patients have results by 6 months or by 1 year. Their penile size also improves a little bit. The erection time improves, like it was 5 minutes initially, it will be 10 minutes or whatever. Then the quality of sex improves, the hardness of the penis is better, and the venous leak may stop completely or at least reduce. So most of them report success there, and some report partial success, such as almost all patients have 25% to 50% improvement. Some patients may have more than that, but some improvement is always there. And at the end of 1 year we assess, and if necessary the therapy can be repeated also. So the therapy is quite an ideal one. The cost is also reduced compared to other centers. We are charging almost 1/3 of it, which is very cheap and acceptable. So cost is acceptable, there are no side effects, the results are good, and the therapy can be repeated any number of times. I think it has the features of almost an ideal therapy. So in the description box below you have my address, my website, my phone number and all my details, and you can contact me on WhatsApp or phone or through email and get appointment, and you can get benefited from this therapy. Thank you very much.